Hi, my name is Jared Carter, and I have a cash-based physical therapy practice in the state of Texas, where we do not have direct access, or patients do not have direct access to physical therapy treatment. We can evaluate without a referral from a physician, but we cannot begin treatment until we have that referral from a physician or other related practitioner. Now, I often get the question, can a cash-based practice work or be successful in a non-direct access state? And so the answer is, obviously, the short answer is yes. Not only have I had a successful practice in a non-direct access state for over 8 years now, but many others I've seen pop up in Texas that are doing quite well. But there are some very important things to keep in mind, both in the way you plan your practice and your growth, as well as some strategies that I've found that have helped to minimize the issue of patients having to get a physician referral before you can get started with actual treatment. And there are a few other states that still have those same ridiculous laws limiting access to physical therapy. So hopefully this can help those out there thinking, wondering what to do, or thinking, hey, is this possible? Can I be successful when I have these limitations? I don't know when the laws might end up being changed. In Texas, I don't think it's happening anytime soon. So first and foremost, with your planning, don't look at cash-based practices outside of your state and see how quickly a lot of them can grow and scale and think that's going to apply directly to you as well. Even with a lot of really sophisticated marketing and just a ton of hustle, my practice has definitely been slower to grow than I expected. And when I really looked at the numbers and all the different factors, like, why am I not seeing quite as much growth? And when we looked at how many patients or prospective patients were calling and saying, I'm ready to get going, and they didn't have a physician referral and didn't, for whatever reason, want to go deal with getting one, or didn't want to spend a few $100s, because they hadn't met their deductible just for a 2-minute visit just to get a little piece of paper, for any variety of reasons that people decided, no, I'm not going to deal with that. I'll just go see my massage therapist, or I'll go see a chiropractor or whatever. We were losing like 2 or 3 patients a month, which is, for a small practice like mine, that's a huge hit, and that definitely will dampen the growth curve. So it's not that it's a barrier to entry, but it is a hurdle, and it will potentially slow things down. So just keep that in mind and plan accordingly. Now, before I talk about the strategies of how to minimize the impact, let me just say, one of the reasons that this seems to be such a big issue for cash-based practices or out-of-network practices is that we tend to have a higher percentage of non-physician referrals. More patients are coming to us from non-physician referral sources, and that's because most physician practices are in-network. So the majority of their clientele are of the mindset that insurance should cover any of their healthcare needs, which is fine. There's nothing wrong with that. It's just that instead of trying to fight or change that mindset and get at a small percentage of their population or their client base that might be willing to pay more out of pocket for a higher level service, it's actually it behooves us to actually do more direct to patient marketing, direct to public and consumer marketing, and marketing to referral sources that are like personal trainers, yoga instructors, massage therapists who are already in kind of that cash-based realm for health and fitness and wellness services. So that's a background of why so many of the clients that call practices like mine haven't gone to a physician first and were sent directly from a physician. We certainly get those now that we have a good relationship with some physicians. It's not that we don't get any, it's just not a huge percentage of our patient population. So when people call and they don't already have the referral, there's a few things that we do to try and figure out the situation and get them in as quickly as possible, and some things that hopefully you can use as well. So first I'm going to talk about the conversation we have with them when they don't have that referral, and then I'm going to talk about some other strategies that you can have set up and put in place to try and minimize this as an issue. First and foremost, in Texas at least, and you have to check your Practice Act, we don't have to get the referral from an MD or a DO. It can also come from a PA, nurse, an advanced nurse practitioner, podiatrist, dentist, and even chiropractors. And we have some good friends who are chiropractors. So when we're talking on the phone with them, we might say, look, have you seen anyone for this? We ask because we have to have a referral before we can start with treatment. We can start with an evaluation or a free consultation, but we can't actually start treatment until we have that referral. Now, if they don't have the referral and they haven't seen anyone for the issue, then we explain, okay, well, this referral can come from any of these types of practitioners. Do you have anyone in your network that you could get into quickly to get that referral? And sometimes it's like, oh yeah, no problem. I was going to go in anyways for this or that, and then, problem solved. Sometimes it's like, no, not really. And you say, well, what about in your friend or family network? And what about outside of Texas? It doesn't have to be that that person is licensed in the state of Texas. And again, this might be different in other states. So check your state practice act. But that's something where now and again we'll have someone who has got like an uncle in Kansas who's a dentist, and he's fine to fax us over a referral and we can get started. So if there's no one in their friend or family network and they've not seen anyone for it, then we have a couple other options. We have, and this is one of the strategies I would suggest, is to set up relationships with physicians who are looking to grow their practice, and especially if you have any direct MD or direct primary care physicians in your area, or even concierge physicians who are willing to do one-time visits as opposed to just an annual fee as they're growing, just to have exposure to their brand. I would definitely reach out to them, get to know them, say, look here, explain the issue. We've got a lot of people calling us who want to get physical therapy. They're ready to go, but we have to have this referral first. Do you think you'd be willing to get them in for a low cash pay rate quickly? They can come in, you can make sure that they're appropriate for physical therapy, sign off on the referral pad that I'll leave with you. They get exposure to your brand, a quick, cash pay revenue for you, and then, it solves our issue as well. And you just make sure that you're fine with them starting physical therapy and we're good to go. So set up as many of those relationships as possible so that when you're on the phone with that person, if those first two options weren't there for them, and they don't want to, set something up with their primary care, don't have a primary care, don't have an orthopedist that they can get into quickly, then you say, look, we have these relationships in different parts of the city. Would you be willing to go and spend, $50 and do just a quick 5-minute in and out visit? They'll make sure you're okay for PT and then send you our way. And we've had plenty of people who do that. Then more recently, we now have connected with a telehealth. Actually, it's an urgent care group that has a telehealth platform, and we're actually now able to have people download an app onto their phone. We're still working out the user interface. It's not perfect, but they can download an app on their phone and then do, for just $25, a quick on their phone or on their computer telehealth visit, and then they send the referral over to us. So that's really lowered the hurdle even further, which is nice. And then finally, other than those kinds of relationships, or maybe trying to see if telehealth is an option in your state based on your laws, and finding someone who's doing telehealth visits and say, hey, we've got all these patients, could we, who need these referrals, can we set this up where they just, hop on with you and then you get a little money, and, and it's not a referral it's not a fee for, kickback kind of thing. You're not getting any money. You're just sending them business. And if they agree that they are appropriate for physical therapy, then they can send the patient directly the referral. If they don't want to send it directly to you, so that there's no issues with, with like a referral fee or anything like that, or getting business for that referral. So they can just send it directly to the patient, and the patient can use it wherever they like. And then finally, check your laws as well and see if verbal orders over the phone are doable. Because if you have good relationships with a lot of local doctors or physicians, and they're, not all physician groups want everyone to have to get that referral. Like, they're not all in agreement with that and making people come in. Sometimes they're slammed, and they love to have someone that they really trust in the physical therapy world who will do a great evaluation, send over their findings, and say, this is what I really think is going on. And they trust enough to sign off on the plan of care and say, all right, no worries. And if you can do a verbal order, then what you can do, if you have a good enough relationship with physicians in your area or certain physicians, then you can say, on the phone, you can say, hey, who is your physician? Okay, well, I have a good relationship with them. Why don't we set up your evaluation, which we can start and do, and then I can call over there and see if they're fine with just signing off on the plan of care before you come in for your actual first treatment. And so we've done that a couple times. We've not gone deeply in that route, but I know of other cash pay practices that have really used that practice or that strategy well, and it's really, really helped to get people in the door who didn't already have a referral. And then finally, offering free consultations, because again, we can evaluate, but we can't start treatment. And this is huge because a lot of times when people are calling, they're not 100% bought in before they've met you, they figured out what's going on, they're still skeptical. And when you throw up that extra roadblock of, hey, so sorry, but we can't actually get started until we have this referral, and now you got to go to some other clinic and take an hour or two of your time to go do that, and okay, they can't get you in, and you haven't met your out-of-network deductible or in-network deductible, and it's going to cost all this money. And so when you add that hurdle or that friction, you'll lose business that way. And so one of the ways we kind of try to get people over the hump there is just to say, you know what, why don't we just get you in for a completely free consultation? And it's about 20 or 30 minutes, and we're just going to check out what's going on. We're going to figure out exactly what's causing your pain and just start the process of creating the plan to getting you back to, the thing that they mentioned that they're really missing out on or limited from doing. And if you can get them in the door and build that personal rapport with them, they experience, your clinic, your clinicians, or you, and they get excited about utilizing your services. Sometimes that's what's needed to get them over the hump to go and get the referral in whatever form they need to. If the app didn't work or you couldn't do a call-in verbal order or something like that. So I know this was a lot of information, but there's a lot to this topic and a lot of strategies we found over time that, though it doesn't get rid of the problem, it certainly minimizes the issue as much as possible. And hopefully at some point soon, all this will be totally irrelevant, and every state in the United States will allow people to get direct access to physical therapy treatment without a physician referral. So let me know if you have any questions in the comments below. Glad to help out in any way. This has been a huge issue and problem for my practice, and I've been involved on the state level to try and get it changed. But in the meantime, hopefully these strategies will help to minimize its impact on you and your cash-based practice.